Today, we will look at a BodyViz brain builder about the lymphatic system and autoimmune diseases and walk through a case study example. According to the National Institute of Health, approximately 8% of the United States population is living with an autoimmune disorder, and over 80% of those affected are women. In this brain builder, we will look at the intricate relationship between the lymphatic system and autoimmune diseases. The lymphatic system includes lymph vessels, lymph nodes, and organs like red bone marrow, the spleen, and the thymus. Lymphocytes are produced in the bone marrow and come in two major types: T cells, which kill infected or cancerous cells and help regulate immune responses, and B cells, which create antibodies. T cells and B cells respond in different ways against antigens. T cells attach to antigens and interact with them directly. This is called the cellular immune response, or cell-mediated immunity. B cells attack foreign antigens by dividing to produce cells that differentiate into plasma cells. These plasma cells secrete proteins we know as antibodies, or immunoglobulins. Antibodies are carried through bodily fluids to destroy specific antigens. This type of immune response is known as the humoral immune response. Additionally, the lymphatic system returns excess fluid from tissues to the blood. This fluid, which has leaked out of the capillaries due to blood pressure, is collected by lymph vessels and returned to the bloodstream. Common phrases of symptoms such as bloating or feeling puffiness directly refer to this excess fluid when it can be seen and felt in our bodies. Autoimmune diseases are conditions in which the immune system mistakenly attacks healthy cells. With over 80 recognized types, these diseases can present with symptoms such as fatigue, joint pain, rashes, and inflammation. Let's quickly look at two specific and well-known autoimmune diseases. Type 1 diabetes. The immune system attacks insulin-producing cells in the pancreas, preventing glucose absorption. Rheumatoid arthritis. The immune system attacks joints and their linings, causing inflammation and bone loss. While many of the damaging mechanisms of autoimmune diseases remain unclear, it is known that the lymphatic system is significantly involved. Since B cells produce autoantibodies that target healthy cells, and T cells activate immune responses that lead to inflammation, symptoms like joint, lymph node, and limb inflammation indicate lymphocyte activity. While the exact cause of autoimmune diseases is unknown, they are likely the result of a combination of genetic, environmental, and immunological factors. Diagnosing autoimmune diseases can be a challenge. Doctors use a combination of clinical evaluations that include lab tests and imaging. Diagnosis typically begins with a review of medical history and a physical exam to assess symptoms, family history, and overall health. Several blood tests are often used to detect autoimmune indicators, including complete blood count, uses red and white blood cell levels, anti-nuclear antibody test, detects autoantibodies in the blood, erythrocyte sedimentation rate, measures inflammation levels, specific antibody tests, identifies specific autoantibodies related to suspected autoimmune diseases. Doctors will also rule out non-autoimmune diseases in the diagnostic process, such as cancers, intestinal blockages, and a multitude of other conditions. Since autoimmune diseases vary, so do the treatment options. The main goals in treating a patient with an autoimmune disease generally include symptom management, reducing pain and inflammation, and lifestyle modifications. Individuals with an autoimmune disease can live normal lives. As technology advances, so does the ability to diagnose and manage these disorders. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age 28, sex female, chief complaints fatigue, joint pain, feeling stiff in the morning, and swelling. You invite the patient into your office for an examination. Your patient reports chronic fatigue, stiffness, and pain in her wrists and knees. Upon physical examination, you notice joint swelling and limited range of motion. You order several tests and view their results. First, a complete blood count, which shows low red blood cell levels, which suggests your patient is anemic, and a slightly elevated white blood cell count, which is a sign of inflammation. You also order an anti-nuclear antibody test, which returns positive and indicates your patient has autoantibodies. The rheumatoid factor test and anti-CCP antibody test both return positive, strongly indicating rheumatoid arthritis. Additionally, the erythrocyte sedimentation rate is elevated, confirming systemic inflammation. Based on these findings, you diagnose the patient with rheumatoid arthritis. You prescribe a low dose of methotrexate, which has anti-inflammatory and immunosuppressive effects, to slow disease progression. You also recommend physical therapy to improve joint function. This has been a classic example of a common autoimmune disease, rheumatoid arthritis. Thank you for watching this Brain Builder video. Please like and subscribe to our YouTube channel, and if you are new to BodyViz, check out our other anatomy resources and schedule a demo today at bodyviz.com.